This lecture is going to wrap up chapter 15. The only classification that we did not get to was adrenergic neuron antagonists. So we're going to start there. It's on page 207, adrenergic neuron antagonists. And what is that classification? An adrenergic neuron antagonist is a drug that blocks the release of norepinephrine from the sympathetic terminal nerves. The clinical use is to decrease blood pressure. So you got there, decreased blood pressure. Your example, reserpine, is your prototype adrenergic neuron antagonist. And basically that's what I want you to know. What is it? It's an adrenergic neuron antagonist. What does it do? It blocks the release of norepinephrine. What do I see in my patient? A decrease in blood pressure. I want you to go ahead and pause the video and just look at the purple nursing process box that follows the reserpine information. Starts on page 209. And just go through and pull out what you think is the most important regarding assessment, nursing diagnosis, and so forth. So in terms of assessment, obviously we want to obtain a good health history and determine what drugs the patient is currently taking. In terms of nursing diagnosis, cardiac output would be the big nursing diagnosis, decreased related to hypotension and bradycardia. So when I'm taking reserpine, I would expect my BP to go down. Also, my pulse would go down. Another diagnosis could be fatigue related to medication adverse effects. Planning is just basically what am I going to be watching for in my patient, and that is that decrease in blood pressure. Under nursing intervention, so obviously monitor vital signs, especially blood pressure and heart rate. Make sure the patient knows to notify the provider of any excessive dizziness or lightheadedness, mental depression, or chest pain. As with a lot of these medications, if it's lowering the blood pressure, the patient is at risk for orthostatic hypotension and falls, so we want to be watching for that. Let the patient know that therapeutic effects from adrenergic neuron antagonists may not occur for 2 to 3 weeks after initiation of therapy. So it might take 2 to 3 weeks for the patient to start seeing the effects of the reserpine. Under self-administration, make sure the patient knows how to take a pulse and a blood pressure, even if it's a wrist monitor, which isn't ideal, but something that they can use at home to monitor pulse and blood pressure. Under side effects, again, safety. With orthostatic hypotension, change position slowly to help lessen the risk of falls. Inform patients and family of possible psychological changes, such as depression, sleep disorders, emotional lability, memory impairment, confusion, nightmares, and hallucinations. You could also teach patients about the side effect of erectile dysfunction when taking this medication, and advise them not to drive or operate dangerous equipment until the response to the drug is known. All right, so for these practice questions, I'm going to read through them, then give the answer. You can read through them, pause it, and try to come up with the answer on your own. Practice question 1, when teaching a patient who has been prescribed metoprolol about side effects or adverse effects, what is the highest priority teaching point? For question 1, if you answered B as in boy, you're correct. It is most important for the patient to learn how to monitor the heart rate because of the side effect of bradycardia with those beta blockers. So again, it's not just blood pressure that we're monitoring, but pulse also when our patient is taking a beta blocker. Question 2, stimulation of what adrenergic receptor results in the dilation of vessels and decrease in blood pressure? If you answered B, alpha-2 receptors, that is correct. Remember, those are the one receptors that are not like the others. When alpha-2 receptors are stimulated, they inhibit the release of norepinephrine, leading to a decrease in vasoconstriction. This results in vasodilation and a decrease in blood pressure. Question 3, the nurse is teaching the patient about side effects of atenolol. These include, if you chose C, your answer is correct. The side effects commonly associated with beta blockers include bradycardia, hypotension, headache, dizziness, cold extremities. Bronchospasm is one that if you were to look on your chart, is listed as one of those life-threatening side effects that can sometimes occur when taking a selective beta blocker. Again, it sort of goes back into the question about, well, if my child takes albuterol or I take albuterol, sometimes I feel my heart race, and it's a selective medication. Why is that happening? So sometimes, even though they're selective, they do have some effects on other systems. But I want you to understand and know if a medication is selective and know what the goal is for that medication. So in terms of atenolol being a selective beta blocker, we need to know it's selective for beta 1, and I need to be thinking heart, blood pressure, pulse with that medication. For albuterol, think selective, beta 2, lungs, bronchial dilation. Question 4. A nurse is administering epinephrine to a patient during cardiac arrest. The primary desired action of this medication is to A. Epinephrine is a potent inotropic. Remember, it creates a better squeeze of the heart. It strengthens myocardial contraction. It increases cardiac output, promotes vasoconstriction and systolic blood pressure elevation, increases heart rate, and produces bronchodilation. High doses can result in cardiac dysrhythmias, necessitating ECG monitoring. Epinephrine can also cause renal vasoconstriction, thereby decreasing renal perfusion and urinary output. 5. A patient has been prescribed atenolol to ensure safe dosing. The nurse teaches the patient to frequently assess what parameter? If you chose B, that is the correct answer. The side effect commonly associated with atenolol, which is a beta blocker, includes bradycardia, hypotension, headache, dizziness, cold extremities. So again, beta blockers, they need to take their pulse in addition to blood pressure. Question 6. A patient is receiving dopamine IV. Which drug should the nurse have available to treat extravasation and tissue necrosis? So if you look before you try to guess this one on page, let me find it here. On page 205. So epinephrine is your prototype drug that we talked about in class in terms of adrenergic agonists. And on your exam 2 list, and now I'm telling you also in this lecture, other medications that you want to recognize as adrenergic agonists include norepinephrine, not too hard, it has the word epinephrine in it, dopamine, and dobutamine. So in addition to epinephrine, please know norepinephrine, dopamine, and dobutamine as medications that are also adrenergic agonists. And just looking at those, dobutamine is a beta 1 selective medication. The other two are not. So knowing that now, so dopamine is a adrenergic agonist. Go ahead and look through there and think about what it might be, what sort of antidote you've seen associated with an adrenergic agonist, epinephrine being your prototype. If you chose C, phentolamine, that is the correct answer. That is the antidote for IV extravasation of dopamine, also epinephrine. That is the correct answer.